Welcome to a Community Partners interview, where we explore the organizations, opportunities, and resources that look to make change in our daily lives. I'm your host, Lilly Cereghini, and you're listening to Voices for Ability Radio, all abilities, all the time. Today, I'm joined by Alexis Bilyea, who is the Complex Support Worker for Regional Support Associates. Regional Support Associates' vision is people living their best lives in the communities that they call home. And their values are integrity, collaboration, empathy, open-mindedness, transparency, and flexibility. Thank you for joining us today, Alexis.
No problem. Thank you for having me.
Alexis, could you tell us a little bit more about you and what inspired you to work at Regional Support Associates?
Sure. So I went back to school in 2015. I knew that I always wanted to work in human services, but I didn't really know where. So I took a human services certificate program that provided me with an opportunity to kind of see different areas of human services. And in that program, we were able to have a placement, and I did my placement in a classroom and was able to work with some students that had some different kinds of learnings. And so I was able to support them with their different styles of learning. And I realized that that was really what I wanted to do. And so I took developmental services next. And there was also placements there. So I did another placement in a school. And then I did my second placement here at Regional Support Associates and realized that case management was where I really, really wanted to be and where I really thrive and getting to know people and understanding their support needs. So I have been with Regional Support Associates since 2017. And in that time, I continued my education while working here and finished my undergrad in psychology at Queen's University and finished that in 2024, which brings us to today. So I've had a few different roles at Regional Support Associates. I've been an enhanced community response facilitator within case management, and then I've also complex support coordinator, which I am now with Regional Support Associates, also in the case management function. And I've been in this role since 2021. So that's what brings me here with RSA and being able to support people. Adults, we support adults over the age of 18 with developmental or intellectual disabilities.
Busy. It sounds like you came up in the world very quickly too, though.
Yeah, it was good. It's been a journey. I do enjoy learning and always trying to find even professional development to continue learning because things change so much. And we work with people who also change often. So just making sure that I'm continuing to learn, which is important to me.
Absolutely. It's always evolving.
Always evolving.
While doing my research, I saw that you have a couple of services that you offer. Could you tell us a little bit more about your services?
Yeah, so we have a few different services within Regional Support Associates, which is wonderful because we have a multidisciplinary team. So we have clinical services and specialized services, which is occupational therapy, speech and language pathology, and our clinical team, which support with behavior consultation. We also have psychologists on our with our colleagues. We also have assessment services. So in order to utilize RSA services, you have to be connected to the DSO. We get our referrals from Developmental Services Ontario. And so we do have colleagues that do eligibility assessments for Developmental Services Ontario to make sure that they're eligible for services. And then we have case management services, which is the service that I work under. But I do work with my colleagues regularly. There's often our referrals overlap with other services within RSA, which is nice because we do have a very collaborative model here.
Nice. What is the RSA conference all about?
The RSA conference, I had the privilege of being on the RSA conference committee as their chair until last year. I was able to help organize that. So it is a 2-day conference that we hold annually. And we look at different themes. And so a lot of the themes recently have been around trying to support people. I think the last couple of years there's been some things around substance use, mental health support, and trying to get speakers that can talk about those resources that are available that we may not usually know about or how to get in touch with. So this year, I don't really have a lot of information about our conference. I think that they are well on their way to getting all of that information out. But yes, it is a 2-day conference and it is always in October.
Okay, I see. Now, you covered a little bit of this earlier, but I'm still going to ask, are there any restrictions to the services at Regional Support Association, such as age, caregivers or family members only, things of that kind?
Yeah, so we do only support people over the age of 18 that come through Developmental Services Ontario. And different areas within RSA have different criteria that they have to meet in order to come through. So, for example, I can talk specifically about my role. They have to meet certain criteria within their supports intensity scale. So they have a behavior scale and a medical scale. And so they have to meet a certain threshold to come through. There's also opportunities for them to come through for extenuating circumstances, and that is a decision that the DSO makes. And so then when they come through, then my manager looks over the referral to make sure it meets some sort of criteria, whether that's extenuating circumstances or the criteria to actually come through. And then the referral comes to me. So there are the biggest piece is that they do have to be over the age of 18.
Okay, it sounds like the therapeutic model, like the therapeutic referral model.
Yeah, and I think we do have a biopsychosocial model here. So we do look at the whole person when we get a referral, right? We look at medical, we look at all of those pieces. We have healthcare facilitation. So I have a nurse available if the person needs more of a medical model, more of some information about medical things that I might not have the background for. And then we also do, when I receive a referral, we do a health review checklist, which goes over different systems in the body to make sure that the person is doing okay, or if there's anything that they need extra support with in terms of their health.
Okay, cool. Without using any names, could you share a success story with me? What sorts of supports were put into place when someone asked for help?
Yeah, that's a good question. So we do look at like the whole person. We work a lot with families, and we work a lot with individual people, and in conjunction with their families, which is nice, especially if they have a big support network. I have recently had a referral who we've had referrals that get residential placement if that's something that they're looking for. So that would be with an agency. They would go live there residentially if that's what they need. I've had referrals where they come through and they have no support. Nobody's on their support team. And then when I can move their file to closure, they have a great support team that can stay with them for a long time. So those are the kinds of things that we hope to get people connected to when we have referrals, is a great support network that can stay long term with the families or people so that they can continue to have ongoing support.
Absolutely. I mean, that is the going theory, is that doing all of this as a group is a much better idea than going it alone.
Mm-hmm. Mm-hmm.
Especially in terms of having a support network there to catch you.
Yeah, especially when we do receive referrals, as soon as somebody turns 18, sometimes we get them right at that point. And so when they're leaving the children's system, which is different than our system, and they go into the adult system, it's really about connection. It's about keeping connection within their community, trying to maintain connection, especially within schools and recreational activities, and making sure that that their friends are still connected to them and their peers and all of those things, because we know that we all need connection. We're humans, right? So that's a big piece of my role, is trying to make sure that people maintain connections or getting them connections within their community if they don't already have it.
Absolutely. We need each other.
We do need each other. That's right.
When it comes to assigning supports or resources, what's the process for determining what supports or resources are required?
I think it's really up to the person. And that's a lot of my role too, is having conversations with them. And they do need support from a family member, having those conversations with the family member to make sure that we're looking at supports and services that not only make sense for the person, but that the person wants, right? Because we can suggest a whole bunch of resources and supports, but if the person doesn't want that support or they don't think that they need that support, then there's really no point in putting those referrals through. So it's really a lot of conversation. We do a lot of rapport building, and making sure that we are only putting in resources and supports that make sense for the person and that are necessary, and that the person obviously consents to.
It's important to have those conversations because consent on one's own behalf is kind of critical to these sorts of processes. The autonomy of the person, that's one of the number one goals.
Absolutely. And that's right. We want to make sure that the person wants the support, that they need the support, and that we're not just putting supports in place because we think that they need them.
No, for sure. Personalization, that's the idea.
Yeah, absolutely.
So we all have our own trip through life, but what would a common journey through regional support associate look like for one of your clients?
So the nice thing about my job, and one of the things that I love the most, is that everybody's different, and my job's different all the time, every day. Everything's changing. People are changing, and so no one referral is ever going to be the same. But I will say that when a referral comes through, we spend a lot of time looking at resources that are available, going through resources that are available to the families, and the people that we have on our caseloads, making sure that they know about things in their community. Because that's sometimes a little bit of the barrier too, is that some resources and things aren't advertised, right? So families don't know, people don't know. So just making sure that they have those things. So once we get the referral, we spend a lot of time looking at the referral, making sure that what they're connected to makes sense. If there's any gaps in supports and services, then we try and fill those gaps with typically resources that are so for example, like Ontario Health at Home would be a good example. So if the person was eligible for Ontario Health at Home, not using their passport to cover personal support workers, but connecting them to like Ontario Health at Home to provide those supports. So just trying to see and make sure that they're getting all of the support that they require and need. And then we do a lot of team support, like when we're trying to get those teams. So I'd mentioned that sometimes we get referrals and they don't have anybody connected. So one of the things that we do is when we're getting those connections for the family and the person, we're available to coordinate meetings so that the families meet those team members. The families understand that, these people will be kind of longer term than we are, and we kind of develop those relationships. That's another piece. And then I think that once we know that things have stabilized for people and their families, that's when we can start to kind of step back a little bit, right? And see how that team manages and see how they're able to continue on for when we aren't involved, because we don't keep people open for ever. Like we don't have a timeline in my particular role. But we try and build those teams up so that we don't have to be involved, right? We want them to continue on with the families and the people. So we kind of do some like building some capacity. Yeah.
Oh, it makes sense to me. You want people to go on, free and individual as opposed to just being tied to resources forever.
Yeah, exactly. And I think when we talk about people that are getting support from RSA, specifically, I can talk about complex support coordination. We do try and make sure that we're filling those gaps. We're trying to make sure that they have all the supports and services that they need. And then when they're good, we look to move to inactive, and then they're able to kind of carry on. The nice thing about my role is that we don't close a file. We just move to inactive. So if they need to come back through, if something kind of happens in their life or they're kind of struggling and they need to come back through for complex support coordination, we can reopen their file without them having to go back through the DSO.
I like that because it takes such a long time to get through for medical referrals in just your ordinary mainstream, like hospitals and doctors' offices and things like that. I mean, even for relatively minor issues, it can take you several years on these waiting lists.
Absolutely. And like they can call their DSO service navigator and they can certainly have the conversation with them and they can call us, right? Like they don't have to call us themselves. They can have somebody on their team call us and we can get their file reactivated, which is nice. And typically my manager will try and reassign them to the same person. So they're not meeting somebody new, kind of keeping with those that rapport building, right? So they don't have to tell somebody their story over again, making sure that we, obviously, if the person, like the complex support coordinator, has the capacity to take that on. But I think that that's something that, the managers here really try and make sure that it's consistent for the person.
Absolutely. Absolutely. No, that's a great idea. The consistency of having the same person with you if need be again, and having the option to come back without barriers in the way that would otherwise be there.
Absolutely. Yeah.
That's very important. What is the one thing that you see happening over and over again to individuals with disabilities that should not be? And how do you think we stop it?
One thing that I see happening, I think, like I just mentioned, when new people are involved with people with disabilities, they have to tell their story again. And that's hard, right? Especially if their story isn't, it's not easy and you don't want to have to keep repeating yourself. And so I think the nice thing, something that I'm noticing happening, especially like even with DSO, is that they have a service navigator which is able to speak to us, and then we, as people like with complex support coordinator, we can share their story when they give us consent if we're trying to get other people involved, which I think eliminates a little bit of that repetitiveness, which can be hard sometimes when people are sharing their story over and over again to different people. So I think that that's something that I did notice when I first came into the developmental services field, but I noticed it's getting a little bit better, where people don't have to share as much about themselves because we have documentation and we have things that we can reference when we get the referral, so they don't have to tell us everything. We can ask clarifying questions, of course, and we can make sure that we have the accurate information, or if things have changed, obviously they share that stuff. But the kind of like baseline and information that they have to give to everybody that becomes involved with them, I think is getting a little bit more streamlined, which is nice to see.
I like that. I like that. Having experienced this nonsense myself, because medical records are often not shared between cities. I have been a patient at Victoria Hospital and University Hospital here in London, but then also at Sick Kids in Toronto, and they did not share records. So the amount of times I had to repeat myself on just the basics of my personal health care was staggering.
Yeah, and I think we're getting a little bit better. We don't actually do too much in terms of like medical. Like we do have a nurse and she'll often request medical records because sometimes they're difficult to read, right? And kind of interpret. And so she's really good at that. But even like reports from school boards, for example, or things like that, like we can request that stuff so that the people on our caseloads don't have to tell us everything that they've already shared. And when we get a referral, we get the information from DSO. So we have their supports intensity scale, we have their assessor summary report. So we can review that and, like I said, ask any clarifying questions. But I think for the most part, people are typically relatively staying kind of the same. And so we don't have to go through all of those support needs and what they need help with and what they don't need help with. Like I think that we're getting a little bit better with that, and I think that's good. I think that that'll be good for people, especially like you said, you don't want to have to keep telling your story over and over again.
Absolutely. The one that really gets my goat is about my visual impairment. The doctors in different places will ask, Do you still require XYZ vision aids? And it's like, still blind, still blind.
Oh, that's hard.
But in terms of sharing records, though, the internet is a thing. So use it. It makes life much less frustrating, and not just on the medical scale purely, but just for anything, like you say. Information is basically infinitely shareable now.
Yeah, and we do have we share because we work under the hospital too. We have different processes, right? So we can't share information just like as an attachment on an email. We have a secure link that we have to do that's password protected and time sensitive and things like that. So there are, like you said, there's ways to share information, but there's ways to also keep information secure and private so that only the people that need it get it.
Mm-hmm, exactly, because I know that is a primary concern for a lot of people. Will my medical records be safe?
That's right.
In these different strata, but nowadays, yes, because password protection.
That's right. And making sure that it's only going to people that need it, right? That's one of the big things that I share when I get a referral is that the only information that I'll request or request from anybody or share with anybody is relevant information. It's only information that's needed because that's important too, right? We want to make sure that we're keeping people's privacy safe as well.
Makes sense to me. What is the one thing that everybody needs to know about regional support associates?
I think that everybody needs to know that we are here, how to access us. So as I mentioned, through Developmental Services Ontario. So they would typically make the referral for any of our services, except for dual diagnosis justice case management, which is a mouthful of a role, but they do have self referrals for that service. So just knowing that we're here, we have a lot of services available. And we do get our referrals from DSO, and we have a multidisciplinary team. And I think that sometimes when people hear about regional support associates, they think that we only have one service. So we do have quite a few services. And they may not know what the services are. So we do have a website that's available. And it goes through our vision, mission, and values. And we have a note from our director on there, our services. There's also a training and resources area, which touches on the conference that you were asking about. So there's a link there that they can register if they wanted to go to the conference. And I'll just share, just because I'm talking about it. The conference this year is From Systems to Stories, Rethinking Support for People with Developmental Disabilities through Connection, Creativity, and Collaboration, which I think we've talked a lot about today. So that sounds like a really good conference, a lot of speakers, and it's a 2-day conference. And then there's also on our website career opportunities, which will bring you to the Woodstock Hospital website. And then obviously we have some frequently asked questions if you have some things in there. But it also has a direct link to our admin team if you needed to send an email. And they would be able to help with any questions that you have.
Brilliant.
Yeah. So it's a very good website. It's fairly new. We just it's just been getting work done over the past couple of years. So definitely, if folks want to take a look at that, there's a lot of great information on there.
Absolutely. Now, you did cover this somewhat, but if listeners are looking for more information, how can they reach out to you?
Yeah, so on our website, there's an RSA admin at woodstockhospital.ca. There's a direct link. They can click on that. It'll take you to our admin team. So there's several people that would receive that email, and then somebody will answer you, or they will get you in touch with the best person to answer your question.
Perfect. All right. Thank you so much for your time today.
No problem. Thank you very much for inviting RSA to come and chat with you today. It's been very nice.
Yeah, it's been great. Absolutely. Very informative.
Yes.
You've been listening to a Community Partners interview on Voices for Ability Radio. I'm your host, Lilly Cereghini. And remember, folks, stick together because we're all in this together.